Hi there. So I normally do a real estate related video, and this one's going to be a little different because it does hit closer to home. Um, so I'm going to talk a little bit about lupus today. This is National Lupus Awareness Month, and for those of you who know me personally, probably know that I have a son with lupus. So I wanted to kind of educate the public a little bit about what lupus is and why we need to know about it. Um, when my son was 20 years old, he started getting sick and he wound up at the hospital. And after many tests and several days, probably close to a week, he was and being discharged and then getting a biopsy, he discovered that he had lupus. And when I tell people this, they ask me the same thing I asked, and what's lupus? I didn't know much about it. I think I'd heard it mentioned before, but I think it's important because so many people are affected with lupus. Um, let's see, statistically, let me take a look. Um, and so people don't really realize, um, how bad it is. Just because, and it says over more than 200,000 cases per year are diagnosed lupus patients. So, lupus is a chronic long-term disease. Can cause inflammation and pain in any part of your body, and it's an autoimmune disease. So it basically means that your body is fighting itself and attacking healthy tissue. Most common are skin, joints, and internal organs like your kidneys and your heart. For my son, it affects his kidneys. And so that means that his kidneys are like a filter, right? Like a sieve. And so it's supposed to drain out or filter out the bad stuff and leave the good stuff. But in his case, it also does processes out good things, like proteins. So it affects his ability to filter things out. Now, there's different levels of severity from 1 to 4, 4 being the worst, and he's about a 3. Is there a cure? No. And so there's other types of lupus that affect a lot of people get the skin issues and also different parts, different organs, basically. So basically, it causes a lot of symptoms, inflammation. One of the things that we noticed when he got sick was that his ankles were swelling up a lot and he was having back pain and he was very swollen and he had like a rash. And so, and that can also cause a lot of pain. And so with lupus, you have flare-ups, and there's times where if he gets a flare-up, he's in extreme pain. Now you see him and he doesn't look sick. And that's kind of a negative in the sense that people, when people are hurting and suffering from these flare-ups, you can't physically see it, so people tend not to give them any kind of compassion or consideration because they don't look sick, right? So there's four kinds of lupus, and there's systemic, which is the most common. About half of the people with systemic have major organ or tissue in the body, like kidneys, brain, heart, that can be affected. And some more serious complications are kidney inflammation, which is what my son has, where the body's ability to filter waste in the blood, and it can damage it. So he does have kidney disease. And so thank God he's not at the point where he needs dialysis, but there are some that do. And sometimes they even need a transplant. Um, I believe Selena Gomez is one of the well-known lupus transplant patients, right? So um, it can also harden the arteries, build up deposits, and lead to a heart attack. And so there's also cutaneous lupus, which is the skin, and then drug-induced lupus can be caused by certain prescription drugs, okay? Anyone can develop it. Normally, it's women between the ages of 15 and 44. Certain ethnic groups are more prone to it, like African Americans, Asian Americans, Hispanics, and Pacific Islanders. people who have a family member with lupus or another autoimmune. And then there's also neonatal, which is rare, that affects infants and women who have lupus. So who's at risk? Anyone can develop it, but certain people are at higher risk, like women. And then, of course, what causes it? We don't know. But it's an also, we do see some correlation where it runs in some families. My mother has fibromyalgia, which is another autoimmune, so we don't know if there's that correlation. Experts think that certain hormones might cause it, or environmental triggers. And so the diagnosis usually can be vague, but in the instance of my son, he had to actually have a biopsy, which actually was quite painful. And so the thing to remember is, we don't know what causes it, and the treatments usually have their own side effects. So usually they have to take anti-inflammatories. They have to take medicine that suppresses the immune system. Okay. At some point, my son had to take a cancer medication that suppresses it. But the other problem with those medications is long-term use of those can also create problems, right? It takes its toll on your stomach. It also can cause arthritis, and for example, it could cause problems and take its toll on other organs. Okay, so of course, because you're taking an what is it? The medication to suppress your immunity, it could cause higher chance of infection, muscle weakness, diabetes, cataracts, and then of course weight gain and bloating, and that's one of the things that we notice a lot with him. So, it's important to know a little bit about this, because I think we really need to research more and try to find medications and treatments that don't have all these secondary side effects, because there are times where he's just screaming in pain and he just cannot move. And of course, it takes its toll on the patients emotionally, because they feel like it's, their life is over. And that's very far from the truth. Very few people actually get to the point where the lupus affects them so much that they wind up losing that fight. However, it takes a huge toll on their quality of life. So I will do another one of these with a little bit more information every Friday for the rest of the month of May to bring lupus awareness to everybody. Thank you. And if you have any questions, feel free to message me directly. Thank you. Bye-bye. Little reminder that my business is based on referrals. Without wonderful people such as yourself, I could not keep my business running. So if you happen to know of anybody, friend, family, coworker, neighbor that is interested in buying, selling, or investing in real estate, I would love to give them the best level of personal care. Thanks so much. Feel free to reach out, text, email, or call me. Thanks. Bye-bye.